every morning I have 30 people waiting at my front door when I get there at 8 a.m. and we cut it off at 25. So I have to cut off the initial line of people that are coming in, and then I have to turn away people throughout the day just because we don't have the capacity. I mean, you have to build your office to be high volume, kind of churn and burn. I work out of 4 rooms, so I can see 4 people at a time. Yeah, I mean, you just really have to have the space, and same day dentistry for sure is key.
Yeah.
I think like setting up systems is so key to all this. I mean, you have to, seeing same day walk-ins, it's hard to verify insurances. You have to have a system for doing same day insurance verification so you can do treatment and collect properly on the patients. That is key. Collect up front before you do any work. Don't rely on billing people.
Welcome to another episode of Dental Marketing Go. I'm your host, Gary Bird. I am the CEO of SMC National, and we provide new patient flow for offices just like yours. And today I have a doozy for you. I have Dr. Travis. He's from Missouri. He has one practice, but at this one practice, he is seeing 15 new patients a day. And when he gets there in the morning, there's a line of about 20 to 25 people waiting for him to come into his office. You're going to be blown away by this. I've never seen an office structured quite like this before, doing the numbers that he's doing. And it's very, very unique. And it's not as complicated as some people might think it would be. He's actually systematized things in a way that's made his life much easier and creates a lot of happy patients. I looked up his Google reviews. He has an amazing reviews. It looks like his team and his patients love it. So he's definitely filling a need where he's at. You're going to want to stay tuned for this one. All right, Dr. Travis. So you have one office in Missouri. How many new patients a month are you guys currently seeing?
Oh, we see about 15 new patients a day.
Wow, 15, 1-5? Sorry to disrupt the show, but I got something crazy to share with you. We are attempting to connect with all of our listeners. We have thousands of people that listen to this podcast, and we want to meet you in person. We have 4 events coming up, and I want to give you a discount code that you can use for the next week to save $300 off your ticket. The discount code is Gary Bird, and the link is going to be just down below. You can also go to smcnational.com/events. I hope to connect with you in person and help each other grow our businesses. Can't wait to see you soon. Wow, that's a lot. And what kind of patients are you seeing?
Well, we run a big portion of our practice is an emergency clinic. So a lot of those patients are coming in to get emergency services. We take same day walk-ins, and we usually, see about 30 of those a day.
Okay, awesome. And then so you're out there attracting people who are in pain, who need to get, something fixed right away. Are those the kind of the patients you're seeing mostly?
Yes.
Got it. And then what happens from there? So they come in, they need treatment done right away. Are you guys able to perform the treatment right away for them?
Yeah, so we do almost all services same day. We'll do extractions, we'll even do root canals, build up crowns, bridges. I mean, we'll pretty much do any range of services same day. So we really focus on like same day dentistry.
Awesome. Okay, that's huge. Yeah, especially for those emergency patients. And then are you retaining the patients that you're getting, or are they kind of a little more transient because of the nature of the kind of patients you're seeing?
I mean, if someone comes in with an emergency, they typically have a larger treatment plan. So they will come back a lot of times, and they do stay. But some people only want to go to the dentist when they have a problem. So we will keep on seeing those people back as emergency walk-ins over and over. But the goal is to create a treatment plan and to see them.
Got it. Okay, so fix the problem that they're coming in for right away, which we call that like the single tooth approach. Like, what's hurting you? That tooth. Yeah. Okay, we're going to take care of that tooth. And then you're saying, hey, you have all this other work. We don't want to do that today, but maybe in the future we can keep working with you and trying to get them to do the rest of the work. And that sounds like it's been pretty successful for you. So how are you getting that many new patients every single day?
I mean, honestly, it's a lot of word of mouth. And we also, I just feel like if you provide the patient with a good service, and they're happy, they spread the word, and they're wanting to come back.
So it's mainly patients telling other patients?
Yeah, I would say it's mainly word of mouth. We've
That's
been
really,
in the
really cool
for like 50 years or so. So,
Oh, your practice has been there for 50 years?
yeah.
Ah, so okay, so did your father, right? Your father started the practice, is that right?
No, it was like a family friend.
Okay, family friend. And
Mm.
so they started the practice 50 years ago. And did they run it the same way you're running it right now?
Pretty similar, but I took it over. It was busy. Since then, we've expanded into a new facility, and we're now actually building out a new facility that will just be geared towards emergency walk-ins.
Wow. Okay. And so do you feel I haven't met a lot of doctors like you that are focusing on this, right? So a lot of
Mm.
people do focus on emergencies, but it's usually a subset of what they're focusing on. You know what I mean? They're more like the family dentistry, and we do emergencies as well.
Yeah.
Do you think that that's given you a competitive advantage over other people, or do you think, or am I just missing the mark? And there are people out there doing a lot of this, and I just haven't seen it.
I think a lot of people, when they go into a dental office for emergency services, they're not actually getting the work that day. I think the dentist will kind of push them off with like antibiotics or pain medication rather than actually treating their main problem that they're coming in for. And I think that people know that they can come to us, get same day work done. And I think that that has just attracted a lot of people to come in to see us.
Wow. Okay. And then do you feel that? So are you the only one in your area with a practice like this?
We
Like
have a
outside of like
couple. We
o-
have a couple
outside of
emergency
like
clinics,
okay, there are.
specific emergencies. Yeah, but I mean, we offer the full service, so then they can become an established patient afterwards too. We are one of the only ones in our area, like close proximity to us, that does provide that.
That's awesome. So this is so if someone else was out there and they're, maybe they have like 3 or 4 practices and they really want to see more volume, they want to get more reps in for maybe a younger associate. This
Hmm.
sounds like something that would be a great way to do that, is just to say, "Hey, let's just take all these emergency patients that are out there because there's a lot of them."
Yeah,
Do you do you do do you feel that this is like a scalable model that you could like continue to open up these kinds of practices if you wanted to?
definitely. I mean, I have every morning I have 30 people waiting at my front door when I get there at 8 a.m. and we cut it off at 25. So I have to cut off the initial line of people that are coming in, and then I have to turn away people throughout the day just because we don't have the capacity.
Wow. Okay. This is so interesting. So I'm thinking through my head, like, have I seen this model anywhere else? Like, ran the way that you're doing it. The closest I can think of is like pedo Medicaid offices or like Medicaid offices, but you're not really positioning yourself that way, are you? Is it largely insurance driven or?
I mean, it is largely insurance driven. Um,
Okay.
so yeah, I mean, that is a way to get people in the door is by taking all insurances. Um,
Okay.
in
Are
our
a lot of
state,
them Medicaid and
yeah, in our
state
state, the
insurances?
Medicaid rates are really good too. So it's higher than, for instance, way higher than Cigna. You know,
Oh, wow.
so I'll get higher reimbursement through Medicaid than I will through some of the private insurances.
Got it. Okay. And then how do you, when the patient does the treatment, are how like, so you're seeing tons of patients, so you're seeing 15 new ones a day. How many
Yeah,
of those would you say are actually coming back and becoming recurring patients through your hygiene schedule?
I'd say probably half.
Okay, so that's not so okay. That's huge. So you're going to be able to keep growing really really fast if you're keeping half of those um, into your hygiene. I mean, that's a ton of new patients. That's I'm just doing the math on it. 27 times 20. I mean, you're talking about adding 140 new people every single month to your roster.
Yeah,
That's a lot of people. That's a big practice really really fast.
yeah.
So any advice for people out there that are thinking about taking this approach? Is there outside of the insurance? If you take the insurance component out of it, what are some other things that people need to keep in mind about this approach?
I mean, you have to build your office to be high volume, kind of churn and burn. I work out of 4 rooms, so I can see 4 people at a time. Um, yeah, I mean, you just really have to have the space, and same day dentistry for sure is
Yeah.
key. Um,
Yeah, a lot of you got to have a lot of space. That's the part that most people don't realize when they don't do same day, is that you have to have space to be able to move the people to do the treatment and keep the new patients flowing in at the same time, right? So you always have to have extra available rooms to be able just to flip to treatment right away, right?
Yeah, I mean we have 16 operatories, um, so within like a 4 operatory office, I mean you could not have this model.
Yeah, that makes sense. And then what kind of volume are you doing collection wise? Are you comfortable sharing that? If not, I understand. But what does it kind of look like from a revenue side?
This year, the last 2.5 months, we're doing about 550,000 of collections a month.
Got it. Okay. So this is a big practice. This is
Yeah.
much bigger than your average practice. And then where's the core of that coming? What kind of treatment?
Just general dentistry, single tooth dentistry. We're not doing any big cosmetic cases or big implant cases. It's just run of the mill dentistry.
That's awesome. So
Yeah.
so for people listening out there, there's lots of different ways to be successful, right? You don't always have to do just the all on four, just this kind of approach. There's so many different ways to be successful and run a business. You just have to find them. And when you find something and create an opportunity like what you have, this is really, really cool.
Mhm.
So what are some other things that if someone's thinking about doing something like this, what are some other things that they better keep in mind just as they do as they consider all of their options?
I mean, I think like setting up systems is so key to all this. I mean, you have to, seeing same day walk ins, it's hard to verify insurances. You have to have a system for doing same day insurance verification so you can do
Mm,
treatment and collect properly on the patients. Um, that is key. Collect up front before you do any work. Don't rely on billing people. Um, I My office is set up so we have triage rooms also with like X-rays up front. So we diagnose and take the X-rays up front before they actually get in the back. So your operatory should
oh,
be saved for actually performing dentistry rather than diagnosis and X-rays, I believe.
ooh, okay, that's a good one too. I really, really like that. Where did you learn that? Because that's not typical dentistry setup.
It's just the way that the office when I bought it was set up, and it worked.
Got it. Okay, that's
So,
really cool. That right there. That's the kind of stuff I love hearing because it's just again, I'm sure somebody else does it out there, but it's like people just you don't think of that until someone says it.
yeah.
Um, and I love the same day verification. How are you actually doing that? The same day verification on insurance.
I use Support DDS. I don't know if you're familiar with them. They're
I
outsourced.
love we use support DDS with tons of our clients.
Yeah, so I have somebody in Zimbabwe that he'll see that a new patient was added to the schedule. He'll immediately start working on the insurance verification.
Got it. So they're working on it before the patient even hits the door. If they've signed up, if it wasn't just a walk in, they're working on it right away.
Yeah. Yep.
That's cool. That's smart too.
Yep.
Anything that you had to do with your pricing to because here's the thing. There's like your loss leaders, right? So you got your exam and X-rays, you got your cleanings, and then you
Mhm.
have your what you charge for the treatment, and then what insurances they're going to take and what they're not. Is there anything special that you had to do there that people would be interested in?
I mean, a lot of the patients that come in for emergencies are cash patients too. Um,
Mm,
because people with insurance don't get regular dental care. So,
yeah,
they're coming in for an emergency. They're needing same day treatment. We charge $100 for the exam and X-rays. Um, and then we charge 160 for a simple extraction, um, but nothing out of the
nothing
ordinary.
crazy.
Yeah, I mean we just started offering Sunbit to for patient financing.
Oh, nice. How's that going? That was going to be my next question. Is like, do you do financing or how do you make that all work?
Yeah, it's been really great. I mean they approve anybody with a 500 credit score or above, so we're getting a lot
That's
more
almost everybody.
yeah, so that's been
So has
great.
that increased the amount of treatment that you're doing now? Because before people were just like, I can't afford it, and now they're like, they can finance it.
Yeah, for sure, that's been really great because we used to only offer care credit, and there
Yeah, which
was
care credit's tough. They only approve like very select few people.
yeah,
Yeah,
so
that's really cool.
mhm.
Sunbit and so Sunbit does down to 500 credit score. And then what's your average like people that are putting into that couple $1,000, $1,000, something like that?
Yeah, couple thousand.
Perfect. This has been really, really good. Okay, so last couple questions for you. If we're sitting in a stadium full of entrepreneur dentists like yourself,
Hmm.
they want to grow their practices. They're just getting started. They maybe have a practice or two. What would be your word of advice just based on your experience?
I think do everything to get butts in the chair. Honestly, I mean, I know that a fee for service office is like everybody's dream, but that just seems like a really hard model for somebody starting out. I mean, I'm a big proponent of taking insurances. I mean, there's a way to make it work for sure, and there's a way to be very profitable doing it. Um, you know, um, I know we had kind of mentioned my mobile unit too.
Oh yeah.
I kind of started that to get butts in the chair. So we were doing teledentistry, asynchronous teledentistry to go out into nursing homes, um, and doing treatment plans. And then I had a transportation company that would pick the patients up and bring them into my office.
Wow.
And that was a
Okay,
good.
so let's talk just a little bit about that. What
Yeah.
what what have you seen with that, and how has that been going?
I mean, it was just a good way at the beginning of my me practicing to get people in the chair and to get my profits up. So, um, yeah, I mean, I could have filled out a schedule with just the amount of treatment that I diagnosed through the mobile unit.
Wow, that's excellent. And
Mhm.
and there's no rules against like transporting people to the office and stuff like that. Is that all allowed in where you're at?
Yeah, so it was a separate company that it was billed through their insurance also. So, the insurance was paying for it to be transferred, but we also took other rides too.
That's great.
Yeah.
Awesome. Well, this has been really, really good. I've learned a lot here. I
Mhm.
obviously I know about emergency dentistry, but the way that you've done it, you're the first that I've seen pull it off at this level. Do you know anybody else doing it like this? Like, do you know people that have kind of copied this model and done
No,
it to the scale that you have?
I don't believe so. I've seen recently some emergency dental offices open, but yeah, I'm not that I'm familiar with.
Awesome. Well, great stuff today. Thank you so much for coming on. I really appreciate it.